I've been watching your pretty smile the whole time.
Thank you. Dr. Oz, I am Dr. Sylmara Chatman, family medicine for almost 30 years, but I am now a functional medicine specialist. I have watched you over the years talk about functional medicine and on your show, and I'd like you to explain, please, why are you such a big advocate of functional medicine, especially as it relates to intestinal health and leaky gut syndrome?
Well, Sylmara, thanks for being a real doctor, because a family doctor has to do all the early warning for our patients. Functional medicine, for me, gained a lot of credibility because I saw it practiced in my wife's family. We live up in a church community called Bryn Athyn. It's in Huntington Valley, Montgomery County. And my mother-in-law has herbs and fruits and vegetables, but she would use a lot of these for medicinal purposes. The power of food to keep us healthy, to eat food coming out of the ground, looking the way it looks when you actually consume it, is a natural approach to life that keeps people healthy for longer. When you look at the blue zones with Dan Buettner, I traveled to many of these, I saw the same thing. So it wasn't rocket science. It was actually much simpler to deal with the complexities of intestinal gut. While doing that, though, I began learning about exceptions. The different flora that we have in the gut, the 500 species that could kill us, but are held at bay by the millions of others and trillions of bacteria generally that can hinder the dangerous ones from hurting us. But they're all there for a reason, right? The balancing act. So as I got smarter about intestinal flora, I began to realize how much of our health was dependent on it. I'll never forget learning two realities. One, that we have more nerves in our guts than neurons in our brain. And the fact that 90% of the serotonin in the body, the feel-good hormone, is made in the gut. Both of which translate to, you have blank for brains, because you sort of do. You got it. I love that. Even if one person gets it, because at home, no one laughs at my stuff at home. I get nothing back. It's like, but also, our happiness is intent in our gut. And the functional abnormalities often manifest themselves in the gut, and we ignore it. We think it's normal to have pain after you eat, or reflux, or the half a dozen other varieties of issues where our body's screaming to us to listen, but we're not.
Yeah, we're not. So our healthcare system in America, as we know, is broken. I mean, our traditional healthcare is so disease model management focused. Why do you think we focus so much on sick care versus health care in this country?
This is why I went to Wharton Business School. It's where the money is. I get paid thousands of dollars to do open heart operation. I don't think I get paid more $100 to recommend a different dosing of a statin drug or treatment of hypertension. I get paid probably nothing to tell you to go eat better and exercise more.
Right.
I started doing television because I realized that, and my wife said, America's not getting the message because you're not giving it to them. So go out and give it to them. Go out and start talking to people and do it on media, because you can make a lot of noise that way and people will pay attention. And so I started making the shows in part to speak to people as though they were in my office, but before they came to my office. Right. To give them the advice that would empower them. Because remember, this white jacket you're wearing, right? It's doctore. The doctor word comes from the Latin for teacher.
That's right.
Doctore. So if we're teachers, we have to have better educated students. By educating people before they walk into the office, we can make that conversation a richer one. And I think that's hopefully one of the ways we'll get past this crisis. But people are changing. People are realizing they want their own doctor, hopefully a family medicine doctor or a functional medicine doctor who can be their coach, and they want transparency into what's going on. What do the drugs cost? Which ones work better? Which scans are the best ones? So they can actually play an active role.